Well, and I think if you're looking at the statistics, conservative care, which we're not just talking about getting an adjustment, we'll do laser, we'll do decompression, and those are all modalities intended to help the disc heal, not just get you out of pain. I always tell my patients when they're in pain with a disc herniation, I'm like, one of the biggest concerns I have is that you're going to feel better before you are better. And I'm always asking, why do you think that's a concern of mine? I want to hear them say it. And because I'm going to get cocky and start doing things I shouldn't do. I'm like, yeah, it's called relapse. And, back in the day, you got surgery. If you were one of the 30% that were successful, 2 years after that surgery, you're still happy, right? But they did studies that showed that 20 years after, the patients had an average of 2 to 3 more surgeries, and they were not happy. They wish they'd never met the surgeon. And again, the surgeon will tell you, do everything you can before going under the knife, you know what I mean? Well, they did a comparison study of patients who had gone through conservative options like what we do here. And again, assuming it's successful 2 years out, that patient's also happy, but 20 years later, they're still happy. And there are a few that end up in surgery because they've waited too long. But the name of the game is resolution, get it healed, and if anything, at the very least, push off any surgeries as long as possible.